Hello guys, welcome back. Today we are going to explain the symptoms of the COVID-19. I know there are many videos on the internet talking about the symptoms of the COVID-19, but we are going to take time to explain the symptoms of the COVID-19, why we experience what we experience when there is a viral infection. So if you're a medical student or you are someone who is curious to know more, then let's get on with it. There was and still is a lot of uncertainties with the various symptoms of COVID-19 because most patients exhibit just a few of the symptoms, but then they still test positive to the COVID-19. So the first symptom is fever, and fever is just defined as body's temperature above the normal range. So the normal range is between 36.5 to 37.5. What it means is that anything around 38 degrees Celsius and above is considered fever. So the hypothalamus has a set point for the body's temperature. So in response to infection, the brain may reset the body's temperature to a higher set point. This is because some viruses die with increased body temperature. So that is the explanation to why we have high body temperature when there is an infection. So the second one is cough. Cough is a reflex that attempts to expel the content of the lungs. So when the virus invades the lungs, the body tries to remove it through coughing. But again, from evolution perspective, coughing is a way the virus spreads from one host to the other. So the coronavirus is still in the system because the virus was able to jump from one host to the other. So the third symptom is dyspnea, what we call shortness of breath. And the reason we experience shortness of breath is that there is extensive inflammation of the bronchioles, which results in excessive activation of pro-inflammatory cytokines like interleukin-1 beta, interleukin-6, and TNF-alpha. And there is also chemotactic aggression of the T lymphocytes at the site of inflammation. This causes tightness of chest. Again, smooth muscles in the airways get constricted when there is inflammation or when there is invasion of the virus, making it difficult for the person to breathe. Because when there is constriction of the smooth muscles, the airways through which the person breathes becomes very narrow. The fourth one is chills. With high temperature, a lot of heat is expended from the body, leaving the person feeling very cold. So the fifth one is muscle pain. So the first reason for the muscle pain when there is COVID-19 invasion is as a result of the presence of the virus itself in the muscle tissues, which induces inflammation. And the second one is that the pain may be as a result of cytokine-induced inflammation. The sixth one is headache. The headache is caused by irritation of the nerves found in the lining of our blood vessels, including those in the head, which dispatches pain signals to the brain. Okay, the seventh one is sore throat. The sore throat is as a result of inflammation of the pharynx, which causes pharyngitis. This may result in difficulty in swallowing. And the last symptom is new loss of taste and smell. The reported loss of taste and smell may be because the virus affects part of the brain, specifically the parietal lobe, responsible for taste and smell. So guys, there you have it. According to the National Health Science in the United Kingdom, most patients who have a sudden loss of taste and smell might be carriers of the COVID-19. So if suddenly you have a new loss of taste and smell, please get tested. It's possible you may have the virus in your system. So isolate yourself when you have these symptoms and stay safe. Thank you very much for watching.